Hi everyone, so I did my project on wilderness therapy as a treatment for adolescents and young adults. Why wilderness therapy? So this research topic was of great interest to me because of my experience with nature growing up. For a while I lived in a house that was completely surrounded by woods. I loved being out in the woods, especially by myself, just hiking the trails, and my dad always took me camping when I was younger, and I just found the experience to be so therapeutic and so peaceful. So I was just really curious about wilderness therapy as a form of treatment. So what is wilderness therapy? One of the studies that I found explains wilderness therapy as the therapeutic wilderness therapy programs typically involve immersion in an outdoor setting, group living with peers and staff, individual and group therapy, backcountry travel, and wilderness survival skills. So basically the participant is out of the home setting for a period of time during the wilderness program, and this could be for days, could be weeks, sometimes even months, just depending on what wilderness therapy program they do go into. So yeah, it's very, the participant is immersed in a whole nother life for a while. So one of the areas of this topic that I wanted to investigate was participant description. So how can participant characteristics help in planning of a program, or just in how can it help us with wilderness therapy in general? So from one study, it said that research has previously shown that knowing the participants' characteristics can be beneficial in determining the program's effectiveness. So for this study, who are they? A descriptive study of adolescents in wilderness and residential programs. The results of this study showed that one interesting thing was that they tested the IQ scores, and they were higher than expected. They were higher than the average. So it was a very intelligent group, as well as almost half had recently experienced a traumatic event, which I thought was pretty crazy, and about 86% reported using illegal substances. So substance abuse was something that was very prevalent among the population studied. And so the authors just make a point at the end that, using these results, they made suggestions about wilderness therapy programs. So just using the IQ scores as an example, they said that students should be challenged and provide a curriculum that provides engagement in these programs, because they had behavioral issues in school. A lot of them got suspended or expelled, things like that, but they were a very intelligent group, so they suggested maybe they just needed to be engaged more. And as far as the traumatic events go, this is a table found in the study that just shows what kinds of traumatic events they had recently experienced. So a little less than half said that they experienced no recent trauma, but then the rest of them said that they experienced these types of traumatic events, which I think is just really important in considering the type of program and the style of the program, knowing what these kids have recently gone through. So an example of a wilderness therapy program is the SUWS of Carolinas, and they offer programs for children and adolescents. And I liked this program because it showed different wilderness experiences that the participants could have based on their characteristics. So Seasons was for children ages between 10 and 13 that struggle with behavioral issues, social skills, defiant behavior. Phoenix Outdoor was for older teens, which focused on anger issues, substance abuse, school issues, things like that. So there was in total, I think they offered 4 programs, and you can check those out on the website that I listed below. So really, really interesting program. So the effects of wilderness therapy. I found a couple articles on this. One study that I found is the effect of wilderness therapy on adolescents' cognitive autonomy and self-efficacy, results of a non-randomized trial. So basically the findings suggest that it may provide adolescents with the capacity to tackle decision-making dilemmas in a successful, constructive manner. So this was very positive results. They showed improvement from intervention, but also from partial intervention. So there was 3 different groups, and then there was a control group. So one of the groups had full intervention, and 2 other ones had different forms of partial intervention. And when compared to the control group, they all showed to have improvement in cognitive autonomy and self-efficacy. So, yep, those are really great results. And research just needs to continue to grow in this area because most of the studies that I found mentioned at the beginning that there hasn't been that much done studying wilderness therapy. So another article for the effects of wilderness therapy was actually looking at young adults. So efficacy of wilderness therapy for young adults at first look. So this was actually a pilot study, which is really interesting. It was 3 years long. I think it studied almost about 300 participants, and the sample of young adults reported experiencing real and practical change from intake to discharge. So that was one positive finding. A limitation in this study was that there was a low response rate for the follow-up questionnaire. So even though they did show some improvement from the beginning of the program to the end, it is really important to test how participants feel, months after leaving the program, if that's stuck, if they felt, no, never mind, it didn't make that much of a change. So, yeah, the study didn't have a very high response rate, so that's something that definitely needs to be looked at in the future. But it is a promising first look into this form of treatment for this specific age group. Long-term and aftercare. Aftercare is just as important as the actual program. Because these teens and young adults, they're taken out of their life, completely put into this whole new kind of atmosphere. It is really important that they need time to transition back into their life and use what they've learned. A lot of teens actually go into residential programs after the wilderness therapy programs before returning home. So I found one article, Descending from the Summit, Aftercare Planning for Adolescents in Wilderness Therapy. This was really interesting because it kind of compared wilderness therapy programs to kind of like climbing a mountain and then having to descend the mountain. So at the top of the mountain, they experience, a lot of clarity. Towards the end of the program, they have confidence. They have some sort of, moment where they are just very aware and confident. And then when they descend the summit or after the program, they may lose this sense of clarity about what they've learned or changes that they want to make. So this article just kind of discusses the importance of aftercare for both teens and parents, because it's, typically for results to stick, there needs to be more continued and intensive treatment. And they also make an interesting note that parents, they suggest parents go through some sort of mindfulness practice while the teen or adolescent is in the program. Another thing to consider for long-term and aftercare is that it really matters that there's a successful relationship between the adolescent and the parent or guardian. So an additional study that I found was Shifts in Attachment Relationships, a study of adolescents in wilderness treatment. So results from this study were very mixed. Although there was some improvement by decreased anger and increased emotional connection with parents, from the beginning to the end of the program, they did say that there was a decrease in many levels, such as empathy for caregivers and decreased sense that either mother or father are sensitive and responsive to emotional states and assist with concerns. So this was kind of a negative of the study, but I thought of it, if you wanted to look at it in a positive light, you could say that, now once Now, because these issues have been identified through the program, improvement and healing can take place in the long-term aftercare. So in conclusion, wilderness therapy is shown to be beneficial in some cases and should continue to be investigated and studied. And as a personal note, spending time in nature at any age for whatever reason is great and can really help with stress. And there are my references.